How do you define public health nursing, and what distinguishes it from other nursing specialties?
Public health nursing is a specialized field of nursing that focuses on promoting and protecting the health of populations rather than individuals. Unlike clinical nursing, which often involves one-on-one patient care in hospitals or clinics, public health nursing emphasizes prevention, education, and intervention at the community level. It requires a deep understanding of the social, economic, and environmental factors that influence health outcomes and seeks to address disparities to improve overall community well-being. What distinguishes public health nursing from other nursing specialties is its proactive and population-centered approach. While other nursing roles may focus on treating illnesses or injuries as they occur, public health nurses aim to prevent these issues from arising by implementing educational programs, advocating for health policies, and conducting community assessments. For instance, instead of solely treating a patient with diabetes, a public health nurse might work to develop and implement a program that educates an entire community on healthy eating habits and physical activity to reduce the incidence of diabetes in the first place. Additionally, public health nursing often involves collaboration with diverse stakeholders, including schools, government agencies, and nonprofit organizations, to address complex health challenges. This interdisciplinary approach ensures that public health nurses are not only caregivers but also educators, advocates, and leaders in promoting a healthier society. This distinction makes public health nursing both a fulfilling and impactful profession that prioritizes long-term health outcomes for populations as a whole.
Describe your understanding of the social determinants of health and how they impact community health outcomes.
The social determinants of health are the non-medical factors that influence an individual's or community's health outcomes. These include conditions in which people are born, grow, live, work, and age, such as socioeconomic status, education, employment, social support, access to healthcare, and the built environment. These determinants are shaped by broader structural forces like economic policies, social norms, and political systems, which create disparities in health equity across different populations. Understanding the social determinants of health is critical because they directly impact community health outcomes. For example, individuals living in low-income neighborhoods often face barriers such as limited access to nutritious food, safe housing, and quality healthcare services, which can increase their vulnerability to chronic diseases and reduce their overall quality of life. Education levels also play a pivotal role, as higher educational attainment is often linked to better health literacy, healthier lifestyles, and improved access to resources. Addressing social determinants requires a comprehensive and collaborative approach. As a healthcare professional, I recognize the importance of identifying and mitigating these barriers to improve health outcomes. For instance, by advocating for policy changes that increase access to affordable housing or organizing community programs to promote health education, we can create environments where individuals have the opportunity to achieve optimal health. Ultimately, tackling the social determinants of health is fundamental to reducing disparities and fostering healthier, more resilient communities.
What experience do you have with community health assessments and program planning?
My experience with community health assessments and program planning has equipped me with the skills to address the specific needs of diverse populations effectively. In my previous role, I participated in comprehensive community health assessments by gathering and analyzing data on health trends, demographics, and social determinants of health within the community. This process involved collaborating with local stakeholders, including public health officials, nonprofits, and community members, to ensure that the assessment accurately reflected the needs and priorities of the population. One project I worked on involved assessing the prevalence of chronic conditions such as diabetes and hypertension in underserved areas. Through surveys, focus groups, and reviewing public health records, we identified key factors contributing to poor health outcomes, including limited access to healthcare, unhealthy dietary habits, and low health literacy. Based on these findings, I played a central role in developing a community-focused intervention program aimed at improving health awareness and access to resources. In program planning, I helped design and implement a series of health workshops that provided education on nutrition, physical activity, and chronic disease management. Additionally, we collaborated with local clinics to offer free health screenings and established partnerships with food banks to improve access to fresh produce. By continuously monitoring the program's impact through participant feedback and health metrics, we were able to refine our approach to achieve better outcomes. These experiences have deepened my understanding of how to assess community health needs systematically and translate those findings into actionable programs that foster sustainable improvements in public health.
How do you approach building rapport and trust with diverse communities?
Building rapport and trust with diverse communities requires a combination of cultural humility, active listening, and genuine engagement. I approach this by first seeking to understand the unique cultural, social, and historical context of the community I am working with. By taking the time to learn about their values, traditions, and lived experiences, I can tailor my communication and interventions in ways that are respectful and culturally appropriate. Active listening is at the heart of my approach. I prioritize creating spaces where individuals feel heard and valued, encouraging open dialogue about their needs, concerns, and perspectives. This includes being mindful of nonverbal cues, showing empathy, and avoiding assumptions about their experiences or preferences. For example, when working with a multilingual community, I've utilized translators and culturally relevant materials to ensure inclusivity and clarity, demonstrating respect for their language and heritage. Transparency and consistency are also key in fostering trust. I make it a point to follow through on commitments, keep the community informed about the progress of any initiatives, and involve them in decision-making processes. By engaging community leaders and advocates as partners in health initiatives, I can build a foundation of mutual respect and shared goals. Ultimately, my approach is grounded in a belief that trust is earned through authentic relationships and sustained collaboration. By demonstrating integrity, respect, and a genuine commitment to addressing their needs, I have been able to build strong connections that support positive health outcomes and long-term partnerships.
Describe a time you had to educate a community about a public health issue. What strategies did you use?
In one of my most rewarding experiences, I led an initiative to educate a community about the importance of vaccination during a flu outbreak. The community had a low vaccination rate due to misconceptions and mistrust, which posed a significant public health risk. To address this, I employed a combination of evidence-based strategies and culturally sensitive communication to build awareness and encourage participation. The first step was conducting focus groups to understand the community's concerns and barriers to vaccination. This revealed that misinformation and fears about vaccine safety were major issues. Armed with this knowledge, I tailored educational materials to address these specific misconceptions, using clear, simple language and visuals to explain how vaccines work and their proven safety and efficacy. To reach a wider audience, I collaborated with community leaders, who served as trusted advocates for the campaign. Their involvement helped establish credibility and increased community engagement. We organized interactive workshops at local community centers, where I provided factual information and addressed questions in an open and non-judgmental environment. I also incorporated storytelling, sharing real-life examples of how vaccination had positively impacted other communities, which resonated on a personal level. Additionally, I leveraged multiple communication channels, including social media, flyers in high-traffic areas, and local radio stations, to ensure the message reached as many people as possible. To make vaccination accessible, we partnered with local clinics to set up free flu vaccination drives at convenient locations and times. This multifaceted approach resulted in a measurable increase in vaccination uptake in the community. The experience taught me the importance of understanding the audience, building trust through collaboration, and using diverse strategies to ensure the message is both heard and acted upon.
What are some of the most pressing public health challenges facing our community/region today?
Some of the most pressing public health challenges facing many communities today include the rise in chronic diseases, mental health crises, health inequities, and the ongoing threat of infectious diseases. These issues are often interconnected, influenced by social, economic, and environmental factors that require a multifaceted approach to address effectively. Chronic diseases, such as diabetes, heart disease, and obesity, remain significant concerns. Lifestyle factors like poor diet, lack of physical activity, and smoking contribute to their prevalence. In many cases, these conditions are exacerbated by limited access to affordable healthcare, healthy food options, and recreational spaces, particularly in underserved areas. Mental health has also become a growing public health crisis, with increasing rates of anxiety, depression, and substance use disorders. The COVID-19 pandemic has further highlighted the gaps in mental health resources and the stigma surrounding mental health care. Communities face challenges in providing adequate support systems, especially for vulnerable populations like youth, elderly individuals, and those experiencing socioeconomic hardships. Health inequities represent another pressing challenge. Disparities in access to care, health literacy, and socioeconomic opportunities result in poorer health outcomes for marginalized groups. Addressing these disparities requires systemic changes in healthcare delivery, education, and social policy. Finally, the ongoing threat of infectious diseases, including new variants of COVID-19 and other emerging pathogens, underscores the need for robust public health infrastructure. Vaccine hesitancy, misinformation, and global interconnectedness make controlling these threats particularly challenging. To address these pressing issues, it is essential to adopt an integrated approach that focuses on prevention, education, and equitable resource distribution. Collaborating across sectors and engaging communities in the decision-making process can foster innovative solutions that promote long-term health and resilience.
How would you approach addressing a health disparity within a specific population?
Addressing a health disparity within a specific population requires a multifaceted and culturally sensitive approach that prioritizes understanding the root causes of the disparity, engaging the community, and implementing targeted, sustainable interventions. My first step would be to conduct a comprehensive assessment to identify the underlying factors contributing to the disparity, such as social determinants of health, systemic barriers, or gaps in knowledge and resources. This would involve gathering quantitative data, such as health outcomes and access metrics, alongside qualitative insights from the affected population to ensure a nuanced understanding. Collaboration with the community is essential. I would work closely with community leaders, stakeholders, and organizations that have established trust within the population. By involving them in the planning and decision-making process, I could ensure that interventions are culturally relevant and resonate with the community's values and needs. For instance, if addressing a high prevalence of diabetes in a specific ethnic group, I would incorporate culturally appropriate dietary recommendations and partner with local vendors to improve access to affordable, healthy food options. Education and outreach are also critical components. Tailored health education campaigns that address misconceptions and promote awareness can empower individuals to make informed decisions about their health. Using accessible language, visual aids, and trusted communication channels, such as community centers, places of worship, or social media, can enhance the reach and effectiveness of these efforts. Finally, I would work to build systemic solutions by advocating for policies that reduce barriers to care, such as expanding access to health services, offering free screenings, or integrating community health workers into care teams. Continuous evaluation and feedback mechanisms would ensure that the interventions are achieving their goals and allow for adjustments based on community input and changing needs. By combining data-driven analysis, community engagement, targeted education, and systemic advocacy, I believe it is possible to address health disparities effectively and foster equitable health outcomes.
Describe your experience working with community partners and stakeholders.
My experience working with community partners and stakeholders has been integral to my role as a public health professional. Collaborating with diverse groups has allowed me to implement health initiatives that are more comprehensive, sustainable, and aligned with the unique needs of the communities I serve. In one notable project, I worked with local schools, nonprofits, and healthcare providers to develop a childhood nutrition and physical activity program aimed at reducing obesity rates. My role involved bringing together a coalition of stakeholders to ensure a multifaceted approach to the issue. I facilitated regular meetings to align goals, share resources, and establish roles and responsibilities for each partner. By fostering open communication and emphasizing a shared mission, I was able to build strong working relationships that contributed to the program's success. In another instance, I collaborated with government agencies and local faith-based organizations to address vaccine hesitancy in underserved populations. This involved partnering with community leaders to co-host educational workshops and coordinate vaccination drives. Recognizing that these leaders had established trust within their communities, I worked closely with them to tailor messaging that addressed specific concerns and cultural sensitivities, ensuring that our efforts were well received and impactful. Throughout these experiences, I've learned the importance of mutual respect, flexibility, and the value of leveraging each stakeholder's unique strengths. By maintaining clear communication and fostering a spirit of collaboration, I have consistently built partnerships that deliver tangible benefits to the communities we serve. This collaborative approach has reinforced my belief that lasting public health improvements are achieved when diverse organizations come together with a common purpose.
How do you advocate for public health policies and initiatives?
As a nurse, advocating for public health policies and initiatives is a key part of my role in ensuring the well-being of the community. I believe that the foundation of advocacy lies in staying informed about current public health issues, trends, and the policies affecting healthcare. To advocate effectively, I begin by understanding the needs of the population I serve. I actively engage with patients, listen to their concerns, and identify any systemic challenges they may face in accessing care. By understanding these issues firsthand, I am better equipped to advocate for changes that can improve public health outcomes. In addition to direct patient advocacy, I collaborate with colleagues and other healthcare professionals to raise awareness about critical health issues and share insights that could shape policy. For instance, I participate in local health forums, community outreach programs, or professional associations that focus on health policy discussions. By contributing to these platforms, I can help ensure that the voices of both healthcare providers and the communities we serve are heard. Another important aspect of advocacy is educating both the public and policymakers. I take every opportunity to provide accurate, evidence-based information about health issues, whether through public health campaigns, social media, or participating in policy meetings. Through these efforts, I aim to influence decision-making processes and highlight the importance of comprehensive, equitable healthcare policies that align with international standards and best practices. Ultimately, my advocacy for public health policies and initiatives is driven by a commitment to creating a healthier society, ensuring that every individual has access to the care they need, and promoting health equity. Through collaboration, education, and active participation in policy development, I strive to contribute to a more effective and just healthcare system.
What are your professional goals in public health nursing, and how do you plan to achieve them?
My professional goals in public health nursing revolve around enhancing the health and well-being of communities, especially those facing disparities in healthcare access and outcomes. One of my primary goals is to become a strong advocate for health equity by addressing the social determinants of health that disproportionately affect vulnerable populations. I aim to ensure that healthcare services are accessible, culturally sensitive, and tailored to meet the diverse needs of individuals, regardless of their background or socioeconomic status. To achieve this, I plan to deepen my knowledge and understanding of public health policy and population health management. This includes staying updated with research and global health trends, attending relevant conferences, and pursuing certifications or advanced education in public health nursing. By enhancing my knowledge base, I will be better positioned to influence policies that foster greater access to care and improve health outcomes on a larger scale. In addition, I aspire to collaborate more with multidisciplinary teams, including community leaders, local organizations, and public health experts. By forming these partnerships, I can contribute to programs that focus on disease prevention, health promotion, and health education in underserved communities. Working with such teams will also help me learn new strategies for implementing effective public health initiatives, ensuring that they are sustainable and culturally appropriate. Furthermore, I aim to build my leadership skills by taking on roles that allow me to guide and mentor other nurses in the field. As a mentor, I can share knowledge on the importance of public health nursing and encourage others to get involved in advocacy and policy work. Leadership will also help me influence decision-making processes that shape healthcare systems, ensuring they are aligned with the needs of the populations they serve. Through continuous learning, collaboration, and leadership, I plan to contribute to the improvement of public health systems and work towards creating a more equitable healthcare environment for all.